Okay, Assalamualaikum warahmatullahi wabarakatuh. We are from Group 1. We'll be presenting the case of congenital esotropia, and we'll be start from me first. My name is Ainsha Fanabila binti Hashim. Metric number 16100070, and I will present regarding the first visit. Okay, for the first visit, this patient is a 4-year-old Malay girl. This patient was referred from iMedic, Jalan Teluk Sisik, and was diagnosed with congenital esotropia. This patient wearing spectacles that was dispensed since 5 months ago. Then she wearing the spectacles all the time. Her mother reported that her daughter's vision is good even without wearing the spectacles, and the patient has history of congenital cataract surgery on right eye at 10 months old with IOL implanted. She was a full-term baby with normal delivery, and her teacher doesn't complain anything regarding her school performance. Okay, so I will proceed to the objective part. For her current RX on right eye from previous eye checkup, she got minus 2.25 with minus 2.5 astig at axis 110 with at plus 2.75. Meanwhile, for left eye, she got plus 0.5 with astigmatism minus 0.5 axis 60. Okay, so we did the retinoscopy, and what we got was minus 1.75 with astig minus 2 axis 110. She can got 69.6 for VA, and for left eye she got plus power, which was plus 1.5 with astig minus 0.5 axis 60. Also, she can got 9.5 using K picture test. Okay, for near vision, she can got N10 at 30 cm for both eyes. Okay, we proceed for Hirschberg. Hirschberg is the most crucial part in this assessment, where we got displaced corneal reflex on left eye at approximately 30 prism diopter. And then we proceed with Krimsky. The Krimsky test shows that she got 40 prism diopter base out on distance, and for near she got 35 prism diopter base out. Meanwhile, for stereopsis using Lang 1, she got 400 up. Okay, and from the ocular motility assessment, we included the result of the position of gaze, and from the examination we can tell that she has the inferior oblique overaction. So the diagnosis we got in the first visit was a compound myopic with astigmatism on right eye. Second, compound hyperopic with astigmatism in left eye, and also congenital esotropia. As for the plan and management in the first visit, we refer to ophthalmologist in private practice for straight away to go to squint surgery.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ahmad Daniel Birosti, metric number 1614533. So I'm going to present to you about the subjective of the second visit. The parents already went to the private practice of ophthalmologists. They were told that surgery is not suggested and are referred back to the optometric clinic for amblyopia therapy. So for the objective, visual acuity aided for her is on the right eye is 3.6 using Sheridan Gardner, and it is expected to have 6.12 visual acuity. And for the left eye, 3.4, which is 6.8 of vision. For the refraction, her refraction for the right eye is minus 175. And minus 2 for seal and axis 110. Vision with the for right eye is 612. Meanwhile, for the left eye, her refraction is plus 150. minus 450 SIL and axis 60, vision is 68. And current refraction is minus 225, minus 250 SIL and axis 110, vision is 612. For the left eye, current refraction is plus 050, minus 050 SIL, axis 55, and vision 68. For the assessment, she has compound myopic with astigmatism in the right eye and compound hyperopic with astigmatism in the left eye. So we can say that there's different of assessment between right eye and left eye, which is anti-metropia, and also she has congenital esotropia. So for the plan and management for the second visit, the parents have been demonstrated to perform patching therapy, but it is not suitable due to nystagmus when one eye is occluded. So they are suggested to do patching therapy using frosted eye patch because nystagmus is visibly reduced and improved with the frosted eye patch. And TCA in 1 month to monitor her vision status. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ainul Hana Muhammad Suhairi, metric number 1611456, and now I'm going to proceed with the third visit for this patient. So the patient's third visit is on 21st November of 2020. Her mother reports that the patient is very compliant with the patching therapy 1 hour every night, and she wears the glasses most of the time. Her distance vision assessment is performed using the Sheridan-Gardner test, and she yields 618 in the right eye and 66 in the left eye. Her right eye VA is slightly reduced compared to the last visit, which is 612, and this could be error due to non-compliance of the patients. Her refractive final RX yield minus 250 with minus 250 SIL, axis 110 in right eye, and plus 225 with astig minus 075, axis 60 with VA of 66 in the left eye, which display a significant difference compared to her current RX. The Krimsky test result yield 20 prism diopter based out at distance and 30 prism diopter at near, which is reduced compared to the Krimsky result findings during the first visit. Hence, it shows that the prism therapy helps in reducing the tropia magnitude. So for the diagnosis for the third visit, she's diagnosed with the same diagnosis, which is compound myopia with astigmatism in the right eye, simple myopia with astigmatism in left eye, congenital esotropia, amblyopia in the right eye, and latent nystagmus in the right eye. So therefore, for the management for this patient, for this third visit is firstly to prescribe the new RX since no abnormal head posture is noticed, and secondly is to continue the patching therapy using the frosted eye patch 1 hour every day for near tasks to improve the VA, and also the patient needs to come again in 2 months to monitor her VA and also the deviation of the eye.
On 9th of March 2020, patient came for 4th follow-up visit. Her guardian claimed that she is complying with the therapy for 1 hour per day and sometimes using phone while doing the therapy. Her mother reports that the eye deviates when she is not wearing glasses. Then the abnormal head posture presents when she is not wearing glasses too. Then patient current glasses is made 3 months ago. So, the aided vision for right eye is 6.9 and 6.6 for left eye using Sheridan Acuity. For near vision, right eye is N12 at 30 cm and left eye is N5 at 30 cm. The retinoscopy result for right eye, the current is minus 150 with SIL minus 250, axis 110, and left eye plus 2 with SIL minus 075, axis 60. while her current RX for right eye is -2 with -250 seal, and left eye +225 and -2075 seal, which is a bit higher compared to the current retinoscopy. Next, the diagnosis for this patient is firstly right compound myopic with astigmatism, secondly compound hyperopic with astigmatism on left eye, thirdly congenital esotropia, and number 4 right eye amblyopia, and lastly right eye latent nystagmus. For the plan and management, the patient was advised to continue wearing current glasses. Second, continue patching therapy using frosted eye patch for 1 hour every day during near tasks to improve the visual acuity. And lastly, appointment for 6 weeks to monitor the visual acuity and deviation.
For the 5th visit, patient came for follow-up on amblyopia and congenital esotropia. The parents claim that patient is complied with patching therapy an hour per day, but sometimes skip the therapy. Patient also claimed that the eyes look straight with glasses, but right eye deviates inward if not wearing glasses. Abnormal head posture occurred when patient was not wearing glasses. Parents also reported the glasses always changed due to lens scratch, and the latest glasses was made at Warisan Optometry. Next, we proceed with objective parts. For VA, aided at distance is 6 for both eye using Sheridan Gardiner. For near vision, right eye is N6 at 40 cm, while for left eye is N5 at 40 cm. For refraction, in right eye is -1.75 -250 at 610 with VA 66 and addition +250 with VA N5 at 40 cm. For left eye, refraction is +225 -075 at Z60 with VA 66. For Krimsky, the results show improvement compared to previous visit, in which for distance is 4 base out and near is 15 base out with constant esotropia. For the assessment, the patient is diagnosed with compound myopic with astigmatism in right eye, while for left eye is compound hyperopic with astigmatism. Also, patient is diagnosed with congenital esotropia with constant esotropia on each eye. For the plan and management, the patient is referred to pediatrics or squint surgeon for second opinion on surgery. The second one is continuing the patching therapy for maintain the visual acuity. The last one is the TCA, which is 4 months after this visit.
For the summary and conclusion, we can see that the patient's parents are really determined to treat their daughter. And we can see this even from the first visit, which was on the 25 September 2019, when our management was to refer her to the ophthalmologist for a squint surgery. And 2 days after that, which fell on the 27 September 2019, her mother had actually brought her to a private practice in KL all the way from Terengganu to get the squint surgery. But unfortunately, the surgery was not performed due to a different diagnosis that was given by the doctor. Apart from that, the patient, although she is just 4 years old, is really compliant with all the therapies given. She is given a patching therapy and she has to wear glasses all the time throughout the 7 months of the visit. And for a 4-year-old kid, it is not something that they actually want to do, especially having something sticking on their face. But for this patient, she is okay with wearing glasses all the time. And the good compliance and determination has actually bring positive results, which we can see from her VA improvement, which was 612 on the first visit, and for the latest visit is 66. Now that the refraction and deviation has actually improved, it is time for us to get a second opinion, which is why for our latest visit, our management was to refer her again to an ophthalmologist in hope that their diagnosis will be similar to us, which is congenital esotropia, because squint surgery is the best and the only way to treat congenital or infantile esotropia. Overall, we can see that every case will possibly have a good prognosis, especially if the patient has the determination and is compliant with all the therapies given. That's all, and with that, I really want to thank you, Dr. Hafiz, for listening to our presentation, and wassalamualaikum warahmatullahi wabarakatuh.